Introduction. Increased intracranial pressure, ICP, is a serious medical condition associated with various neurological disorders, such as traumatic brain injury, brain tumors, or conditions leading to elevated pressure within the skull. Beyond its direct impact on the central nervous system, elevated ICP can induce physiological responses in distant organs, including the gastrointestinal system. One notable consequence is the development of stress ulcers in the stomach, referred to as Cushing ulcers. This video explores the mechanisms behind Cushing ulcers and emphasizes the importance of promptly managing increased intracranial pressure to prevent associated complications. Elevated intracranial pressure. Conditions like traumatic brain injury or brain tumors can trigger an increase in intracranial pressure. This elevation has far-reaching consequences, influencing physiological responses throughout the body. Vagal stimulation. One of the intricate connections between increased ICP and the gastrointestinal system involves the vagus nerve, cranial nerve X. Elevated ICP can stimulate the vagus nerve, leading to a massive vagal output. This stimulation sets the stage for a cascade of events, with significant implications for gastric function, vagal output, and gastric acid production. The vagus nerve plays a crucial role in regulating gastric acid secretion in the stomach. When stimulated by increased ICP, the vagus nerve prompts an increase in gastric acid production. This phenomenon is a key link in understanding the development of Cushing ulcers. Cushing ulcers. The heightened gastric acid production, coupled with other factors associated with stress and increased sympathetic activity, contributes to the development of stress ulcers in the stomach, specifically known as Cushing ulcers. These ulcers pose an additional challenge in the context of patients already dealing with neurological conditions affecting intracranial pressure. Key points. 1. Cushing ulcer definition. Cushing ulcers refer to stress ulcers in the stomach that develop in response to increased intracranial pressure and the resulting massive vagal output. 2. Vagal stimulation impact. The vagus nerve, when stimulated due to elevated ICP, influences gastric acid secretion, potentially leading to increased acid production. Conclusion. Understanding the intricate connection between increased intracranial pressure and the development of Cushing ulcers highlights the importance of a comprehensive approach to patient care. Prompt management of elevated ICP not only addresses neurological concerns, but also mitigates potential complications in other organ systems, particularly the gastrointestinal system. Healthcare professionals must recognize these interconnected physiological responses to provide timely and effective interventions, ultimately improving patient outcomes.